and welcome to SVG-TV's News and Sports. I'm Triska Campbell with the details. 63 new COVID-19 positive cases were reported from 222 samples collected on Monday, October 18th, resulting in a positivity rate of 28.3%. A news release from NEMO said 3 of the new cases were detected on entry screening in passengers entering via sea and air from Grenada, the British Virgin Islands, and the United States of America, and that 2 of these 3 imported cases were unvaccinated. 64 rapid antigen positives were also reported from flu clinics on Monday, October 18th. The news release further noted that 29 new COVID-19 positive cases were reported from 160 samples collected on Tuesday, October 19th, resulting in a positivity rate of 18.1%, and that 26 rapid antigen positives were reported from flu clinics on the same day. It has also been reported that 3 unvaccinated patients were admitted for COVID-19 at the Argyle Isolation Facility. 33 patients have been admitted to the COVID-19 ward at the Milton Cato Memorial Hospital. 31 of these patients are said to be unvaccinated, 1 fully vaccinated, and 1 partially vaccinated. The news release further stated that an 81-year-old male who tested positive for COVID-19 on October 16th died on Monday, the 20th. The patient, who was admitted to the COVID-19 ward at the Milton Cato Memorial Hospital, had no known underlying conditions and was unvaccinated. The other COVID-19 death was a 55-year-old female who tested positive for COVID-19 on October 19th and died on the same day on admission to the COVID-19 ward at the Milton Cato Memorial Hospital. She had no known underlying conditions and was unvaccinated. The deaths bring the death toll in SVG from COVID-19 to 56. 34 new recoveries were noted over the reporting period. 1,699 cases are currently active and 56 persons with COVID-19 have died. 4,729 cases of COVID-19 and 2,974 recoveries have been recorded in SVG since March 2020. Medical Director at the Milton Cato Memorial Hospital, Dr. Charles Wood, said services at the main hospital continue to be impacted by the COVID-19 pandemic, and the management is now decentralizing some of the services. Dr. Woods, who was part of the Ministry of Health's news conference yesterday, said they have discontinued all outpatient clinics and selective surgeries.
Clients are advised to attend district clinics, and they can be referred to hospital specialists directly if necessary. We've discontinued elective surgery. Urgent and emergency cases are still being done. We do this again to reduce admissions to the hospital and so to increase our bed capacity as necessary. X-ray services have also been diverted to outside facilities in the district. We have X-ray services now available in several district centers. So in the hospital, currently we're only doing in-hospital X-rays for the most part, and emergencies.
2 wards at the Milton Cato Memorial Hospital are currently accommodating COVID-19 patients, and a 3rd has been prepared in case of an eventuality. Dr. Wood said that there are just over 60 beds available for COVID-19 patients, noting that most of the patients are usually diagnosed at the hospital.
We still continue accident and emergency services. We have had many cases of COVID in the accident and emergency department. All patients who are admitted through the accident and emergency department are screened by antigen tests, and some present with other issues and are found to be COVID positive, while others come with COVID-19 symptoms.
With about 4,729 cases of COVID-19 recorded in SVG since March 2020, persons are again being urged to take the virus seriously as they could be shortening their lives. This encouragement comes from the medical director of the Milton Cato Memorial Hospital, Dr. Charles Woods, who reiterated at yesterday's news conference that there is no cure for COVID-19, and while there is treatment to help persons recover from the viral illness, they will not always work.
19 care is generally supportive. It's basically a combination of steroids, antibiotics, oxygen. Ventilation is really a last resort and honestly has not really had much effect in the survival of most patients who eventually need to go on ventilation. There is no cure available for COVID, and the treatment is really supportive. So therefore, we have to rely on prevention rather than trying to cure patients who are ill.
To date, 56 persons have died from COVID-19 in SVG, and according to Dr. Woods, no one is exempt from contracting the virus. He, however, noted that the data has shown that the majority who succumb to the virus are those with underlying conditions and are unvaccinated.
Most patients have pre-existing conditions. Well, most of the patients who have succumbed to the disease have pre-existing conditions such as diabetes, hypertension, heart disease. And it's interesting, I've heard many a time that patients would come to me and say, oh, I've got a history of high blood pressure, I've got diabetes, I had a blood clot 20 years ago, you know, should I risk taking the vaccine? But ironically, they're at higher risk of succumbing to COVID as opposed to at high risk of developing a complication from the vaccine. So it seems that the general trend of thought is a little reverse. You should, in fact, if you have any pre-existing conditions, your hope for survival depends on the vaccine as opposed to not taking it.
Dr. Woods further noted that for those who contract long COVID, as it is termed, it will continue to affect one's health, especially the lungs.
It affects the lungs primarily, but it can also cause stress and damage to other organs. So if you have pre-existing conditions, then even after you recover from COVID, you can be more vulnerable to whatever pre-existing disease that you do have ongoing. So ideally, you need to protect yourself from contracting COVID by doing the usual measures we mentioned before: social distancing, hand sanitization, mask wearing, avoiding crowded, closed conditions such as parties and bars and churches, etc. Get a lot of exercise, keep your immune system boosted.
At least 7 persons here in SVG who contracted COVID-19 months ago have been reinfected with the virus. This was noted at yesterday's news conference by Chief Medical Officer Dr. Simone Kiza Beach, who said these persons were unvaccinated, hence they were not immune to the virus.
We do, as a matter of fact, we have currently recorded 7 persons in St. Vincent and the Grenadines who have been confirmed as having COVID by PCR twice. You understand me? So that person had COVID in the past, PCR confirmed, and again, they turn up now months later and they are again COVID positive. So they have been infected again, most likely by a new variant, as we have gamma circulating predominantly here. The Ministry of Health does not recognize that person beyond 1 month as being immune at this stage, because even though there is research suggesting that some persons have very good immunity, what is also known is that that immunity is not consistent.
The CMO explained that the immunity to COVID-19 has to do with an individual's immune system, as this varies in persons.
Person A might have immunity from an infection that might last 6 months, and person B might have immunity that might last 2 months. And therefore, the Ministry of Health, our position is that that person needs to be vaccinated in order for us to say this person has immunity that we can reliably say exists.
Meanwhile, the chief medical officer said they have commenced administering booster shots for fully vaccinated persons, noting, however, that to qualify for a booster shot, one must be vaccinated 6 months prior.
Already commenced giving person booster shots. Persons who have been vaccinated 6 months, 5 to 6 months ago, we are strongly recommending that, especially those in the front lines, so our staff, our healthcare workers who are out there in the front lines, we are recommending that they receive a booster shot. We are also recommending that older persons with comorbidities, that they also get their booster shot. And we have started giving booster shots to individuals who have gone beyond the 6-month period.
Frontline workers here in St. Vincent's and the Grenadines have until November 19th to take the available COVID-19 vaccines as is required under the Public Health Amendment Act 2021. And those who refuse will have no choice but to leave their job once there is no exemption. On Radio Today, Prime Minister Dr. Alf Gonsalves said the final work on the document with the statutory rule and order is completed and should have been published yesterday.
They were going to, the Attorney General told me that they were going to the press yesterday with the Gazette. So once that was done, it means that it will become enforceable, the operational 1 month hence, because that's what the regulations themselves say. So yesterday was the 19th, it will be by the 19th of November that those categories which are listed in the regulations, and we know them already.
The frontline workers who are expected to be fully vaccinated include all healthcare workers, police officers, prison and customs officers, as well as teachers. Prime Minister Gonsalves announced that permanent secretaries have also been added to the list of frontline workers.
The nurses, the doctors, the health workers, really, the people at the port and seaports and customs and immigration and police and the prison officers. And we have included also, well, the community colleges involved in that. And we have also included, for the teachers, we have included also permanent secretaries and heads of department, chief technical officers, because they will be managing the process of people under them in respect of the vaccination. You know, who has taken and who hasn't taken, where is the choice given? You either take it or you get a different job.
Students and teachers across SVG who are engaged in online classes are reportedly being affected by poor internet services, thereby affecting their teaching and learning process. Earlier today, the services of one of the internet providers, Flow, were down, which led to the disruption of or cancellation of online classes for many. In an instant message sent out to customers around 9:33 a.m. today, the company said it was experiencing outages on SVG's internet, fixed line and TV services across the island, and its techs are working to resolve the issues soonest. The problem seemed to have been rectified around 1 p.m. as a follow-up message to customers around this time stated that services have been fully restored, including TV, fixed line and broadband. The company thanked customers for their patience and apologized for any inconveniences. In an earlier interview with SVG-TV News, Minister of Education Curtis King said that one of the main challenges that teachers and students continue to face with the online platform for teaching and learning is having reliable internet service. President of the St. Vincent's and the Grenadines Teachers Union, Oswald Robinson, also spoke to SVG-TV News on the matter and called on the internet providers to take steps to improve their services.
Most schools have been having little difficulty in terms of delivering classes according to plan. Where they have difficulty is with the fluctuation, if you like, in the internet service. And here I'm not speaking so much about the lack there of of internet service. I'm saying you have internet service in most of the areas, but at times the service is not quite reliable.
A situation where some students could not have got into the platform. A lot of that has to do with the reliability of the internet, the technology. So the internet providers need to do something about that.
Meanwhile, the Education Minister spoke on some of the challenges that students in the red zone have been facing during the first 2 weeks of online classes.
Sandy Bay, where the internet in this case was not restored in that area. I must comment there on some guardians though, because they have been using their own data to accommodate the delivery of the online mode of instruction. What I would encourage those parents, if they have not yet done so, both the providers are in fact providing a service where you can purchase a SIM card for quite a limited, well, quite a low price. And that SIM card provides you with data for 1 month. It's basically enough data for the student to log on and participate fully in the online mode of instruction. And so I would encourage them to get that support for their children.
School attendant officer in the Ministry of Education, Alton McPherson, is appealing to parents to ensure that their children attend online classes whenever they are being held, noting that there are provisions under the Education Act that will hold parents accountable for neglecting and refusing to send children to school even if it's online.
For dealing with parents who neglect or refuse to send your child to school. I know it goes from a specific age. I think it goes from age 5 upwards, right? That the parent shall register the child for school. Now, sections of the Act also deal with what penalties can be leveled against parents for not abiding by this. And there is a section of it also that deals with reporting from the principal's end, where the principals should report certain things. And it's set out in the Act what happens to the person.
Counselor at the Family Court, Daniel Wiley James, said that teachers are mandated to report all instances where students are not attending their classes, and students can be referred to the Family Court.
Teacher can follow up. A teacher can make a referral to Family Services, Child Protection Unit. They can make a referral of the child to Family Court, because clearly there's something else that's going on with that child. You know, there may be a domestic violence situation, you know, that needs to be further explored. So, I mean, these are part of the risk factors that teachers and other people who are in society can identify. You know, sometimes when we have like a young person, a young child who's at risk, you know, if we as a society don't care, that young person could fall through the cracks, you know. But if we show care and concern, you know, we might be able to save that young person.
The St. Vincent and the Grenadines Teachers Union will engage parents in training sessions to equip them with the necessary skills needed to assist their children with their online classes. In a recent telephone interview with SVG-TV News, ahead of the union, Oswald Robinson, said that the initiative is a demonstration of the union's commitment to quality education.
For a meeting with the Ministry of Education, we put on the table how could we assist the parents in terms of providing them with some basic skills so that they could assist their students, their children at home, managing the technology and that sort of thing. So we are asking the branches. Now we have 10 branches at the Teachers Union, just like how the island has political constituencies, 15 constituencies. We have 10 branches. So we are asking the leadership of those branches to mobilize the PTAs, the schools in those areas, and we would work through that channel to reach the parents, to equip them with skills in helping their students at home in managing the technology. We gave that commitment to the Ministry of Education. We didn't get any further with that, so we would be doing it from our level.
9 scholarships and 3 bursaries were distributed on Tuesday to students of the St. Vincent and the Grenadines Grammar School by Alumni Association. Speaking at the handing over ceremony at the school compound, former head teacher, now Minister of Education, Curtis King, encouraged the recipients, especially the new students, to work hard to be the best they can.
Hereby Mary, since you have worked so hard to get here, know that you are here. Don't start to play the fool. Maintain that level of interest and hard work. This is not the end of your journey. In fact, in many respects, this is the beginning of your journey, at least at the secondary level. So I'm going to appeal to you. Take your time here seriously. Work hard. And I'm sure if you work hard, work smart, work collaboratively, that at the end of the day, you're going to make yourself proud, you're going to make your family proud, and of course you're going to make this school and the rest of the country proud.
Deputy Chief Education Officer Dixon Finley urged the parents of the scholarship and bursary recipients to continue to support their children on their academic journey and to ensure they stay focused.
We need support now more than ever. We have to work together to ensure that we build this nation, and we can only build this nation if we focus a lot on our education. So I want to once again congratulate all of our students this afternoon who are receiving these awards. Continue to work hard, continue to do your best, and continue to ensure that you make your parents, your school, and the nation of St. Vincent and the Grenadines proud.